The most common opportunity for screening and brief intervention is when a person seeks health care or other reasons. In our example, Mel needs vaccinations for overseas travel, but there are many reasons why people might go to their general practitioner. They may have a health complaint such as a persistent cough or problems sleeping that could indicate the use of alcohol or other drugs. The schedule of appointments in general practice can make it difficult for a doctor to undertake screening and brief intervention. Our case study shows one alternative of having this function undertaken by a nurse while the person is waiting in the practice.
Okay, Mel, I've got a response card so you can follow the questions with me as we go through them. So,
okay.
The questions are really about your experience of using alcohol and tobacco products and other drugs.
Hospitals, particularly the emergency departments, are another setting where use of alcohol and other drugs may be identified. Intoxication and injuries that may result from intoxicated behaviour are common reasons for presentations for hospital emergency departments. In such a busy setting, finding the time to undertake screening and brief intervention is an obvious barrier. One approach that's being taken is the use of 1 or 2 screening questions, sometimes embedded in the electronic triage process. This helps to ensure that screening is undertaken, but the provision of a brief intervention is more difficult to manage. A barrier that is less obvious but just as important is the difficulty of providing privacy and ensuring confidentiality in the emergency department of a hospital. Having the patient complete a computer-based assessment and produce automated feedback based on the information provided is one possible solution to this. The result may not have all the features of an effective brief intervention, but can be expected to go at least a small way towards responding to the obvious alcohol and other drug use. It is not only health services that are likely to identify alcohol and other drug use and have an opportunity to provide a brief intervention. Contact with the legal system, for example through charges of driving under the influence or possession of illicit drugs, family services, and screening for employment purposes are all situations that may lead to the identification of alcohol and other drug use at a variety of risk levels. The implications of admitting to drug use in some contexts may be substantial, and this may impact on the capacity to provide effective intervention. For example, if it is possible that admitting to drug use might possibly lead to criminal charges, to the loss of custody of a child, or the potential to lose employment, then a person is much less likely to be open and honest about their drug use, and in an assessment and brief intervention, even with assurances of confidentiality. On the other hand, a person with legal charges pending, or who has already lost custody of a child, may be motivated to engage in assessment and brief intervention so as to demonstrate their intention to address their alcohol and other drug use. This diversity of contexts and issues means that there's no one single approach. It is a case of adapting the principles of effective brief intervention to the individual and the context.